it's actually not happening.
I'm trying to trace, Brown,
Yes,
where a possible solution could lie. Because we can talk about the problem until the
cows come.
Okay.
Yeah.
Cows come home. We've had a very milky conversation this morning.
Sorry.
yes.
We must
That's
try
a good
to
one.
look into where solutions can come from.
Come through, yeah.
From what I'm hearing you say,
Yeah.
you seem to have more of a problem with the law, regulation, constitution than the people who are in office. Why else, in my opinion, according to the formation
Yes.
of our regulations, our laws, the constitution, it is perfect. The problem is the people who are in office are the ones who are failing to execute their mandate.
But it's us who put them in those
I do agree. So I'm trying to understand that is your position that if we change the constitution by reverting the public health officers to national government,
Yes.
we are going to have a solution? Or is your position that people who are mandated today as per our current constitution are the ones who are failing to execute their mandate?
And that's why we said we need to have a health service commission. Just like the teacher service commission.
No, before forming
Before
any
we go
new
that,
organ.
before, I'm coming to your point about our good governors who are actually in charge of our county bosses. You know, we have had a mix of achievements in respective different counties. You get, like, for example, county like, for example, Muranga, or a county like Nairobi, for example, or whichever county, you find it in health-wise is actually doing better. Other counties are not doing anything in regard to health. That one tells you that how would we prioritize what we do? Most of our county bosses are busy chasing deals and cutting deals and contracts and other things and corruption, as opposed to addressing the real issues. You know, sometimes we also need to be, and that's why sometimes I like Genesis for one fact. Kenyans, we need to reach at a level that we need to come up and say no to this all nonsense about health. Because, for example, most Kenyans are dying as the casualties. Casualties at the county referral are the casualties. But how many they are dying? They are dying because we have a problem with the health workforce. Our healthcare workers are overwhelmed. We have very few nurses, very few clinicians, and very few doctors. And the population continues to appreciate. We know, we're talking about disease, dynamics in terms of health. We're talking about disease burden and also population. So the dynamics keep changing. But we don't change with the dynamics. The norms are still down. The county governors, since the Constitution 2010, since the promulgation of the new Constitution, we seem not to have agreed how many workers, like healthcare workers, we need to employ at our respective counties. If you ask them, they will tell you we have not employed. If they have not, if they have employed, actually, it's actually very few.
Brown, are we having
so the problem is like